This is fluid.
That's fluid, a lot. When I drain a lot of fluid, I generally will use an 18 gauge needle just because you need to be able to get the fluid to pass through the needle.
Ooh, shoot.
So unfortunately, sorry. It's a little tender when you go through, but it's worth it because this fluid is full of inflammatory cytokines and it will really be irritating. Plus, just having fluid there is a physical barrier to bending the knee and extending the knee.
And walking.
So this happens in patients usually who have chronic damage internally in the knee. It could be cartilage damage. It could be osteoarthritis. It could be a meniscus tear. You don't have to inject any medication after doing an aspiration, but my preference is to use some type of anti-inflammatory, and depending on the patient and their health issues, I can use a non-steroidal, but usually we'll use a corticosteroid. In this case, it's Kenalog, and before I remove the needle, I like to have a gauze ready so that I can control any bleeding and put some pressure on the area. We'll clean up the sterile gel and then give her a Band-Aid. If there's a lot of bleeding, we can use a pressure dressing. There's some little capillaries on the surface or varicose veins, and if you nick one of them, you can get some bleeding. It happens once in a while. I will recommend a light activity day, but you can still walk.
Okay.
If you need to walk around, but I wouldn't do excessive walking, and you can ice it. She's done this multiple times. She has osteoarthritis, and she had a work injury, has led her to have chronic knee pain now. So in her case, she has not wanted to get a knee replacement, but it is recommended. So we are discussing now that probably she will seek out orthopedic referral for surgical, because at a certain point when it's bone on bone, the irritation is so bad that the fluid comes back on a monthly basis. And that's a point where maybe we don't want to be doing this anymore and just give her a new knee.
Yeah, that makes sense.
I mean, she had a bad injury.
Yes, a bad injury.
And then she's been walking on it for this many. You fell.
Yeah, I fell on my job. I was a security guard for Con Edison. And I worked at night, and the lights was no good. And it was a mess, so.
And you tore cartilage inside the knee.
Oh, no,
right?
my knee, my shoulder, surgery on my shoulder, my back. That fell messed me up, believe it or not.
Yeah. No.
Just a fall.
A fall can
It really, I know.
Can be devastating.
Yes, it was.